We will change the law so that we take the power to be able to close mass gatherings if we need to, and take other action that you just normally wouldn't, but we might have to in order to respond to this virus.
Do you foresee a time when we will follow, as it were, France or Spain and actually close all restaurants, bars and other shops beyond pharmacies and supermarkets?
Well, we haven't ruled that out. We'll do what is necessary, because the top priority is to protect life, and you do that by protecting the vulnerable and protecting the NHS.
The big political, or the really difficult decision, I suppose, is to what extent you try to control, as you were saying, the spread of the disease, allowing it to spread, but at a rate which the NHS is able to cope with. Or, as some other countries have done, you said, actually the exponential rise in this disease is so great, you just throw absolutely everything at it. You close all the schools, you close all gatherings, you close the tube, you close the transport system, you close the borders. And now you have not taken that position, but that is in itself a bit of a risk, isn't it?
Well, the goal here is to protect life. And the measures that we take have got to be sustainable. And making sure that they're sustainable is a critical part of deciding when you bring them in. But we will stop at nothing to fight this virus. And I think people have got the impression otherwise. We will stop at nothing to fight this virus. And like many countries in the world, and I'm talking to other health ministers and medical officers right around the world, we're taking the steps that we think are necessary for our country right now. And I welcome the debate. I don't mind having a debate about it, because every time I hear somebody talking about it, I listen and I try to find out if there's something that we haven't thought of and something that we need to consider, because all that matters is getting this response right.
And you talk about extraordinary measures we wouldn't normally be discussing. You've said that several times. I'm wondering what we're talking about. Are we talking about police on the streets? Are we talking about soldiers on the streets? Are we talking about arrest of people who are sick but are not self-isolating? What kind of things are we talking about? Closing the borders, closing the airports?
Well, we are going to take the powers to make sure that we can quarantine people if they are a risk to public health, yes. And that's important. I doubt that actually we will need to use it much, because people are being very responsible, and people need to be responsible. There are some areas where I think people really need to think about the impact on others of what they're doing, making sure that if you're buying food, for instance, and loo roll, you buy what you need.
You don't hoard.
Because there's an impact on others. Now, the food supply and food security, we are confident that that's strong. But we've got to make sure that everybody acts responsibly in this overall national effort.